Okay, hi everyone. Take two. Welcome to Live with OKclarity, live experience, bring you clarity on whether to see a therapist or a coach. I'm really excited to be doing tonight's live with Malka, who will hopefully be on shortly, having a little bit of technical difficulties, hopefully which will be solved. Once again, just a disclaimer, everything is for educational entertainment purposes only. And Malka is back on.
Hi,
Okay, awesome.
everyone. Okay, I'm sorry. We're
Awesome.
having one of those days that me, the therapist, is using all my skills with technology. Okay, great. Rikki, where were we up to with things?
Okay, so I actually I started this live again, but I introduced you. I was just telling everyone I'm a coach. Malka's a therapist. She works in private practice with women, families, children. I was telling them you specialize in short-term therapy for high-achieving women and in mental health business coaching, which is business consulting, sorry. And basically learn more about us at okclarity.com. And Malka's gonna take it away.
Yeah, the reason we're pretty excited to do this live today is really to get into um, people need supports at any point in their lives for any given reason. And we really want to talk about when are we going to go to a therapist? When are we going to go to a coach? When are we going to go to, dare I say, neither? Okay. So, yeah.
Yeah, and it's interesting because like as a coach, I very much value this concept that, people always say staying in your lane, and I kind of want to understand from Malka like where's my lane? Like where's the lane of a coach? Where's the lane of a therapist? Like let's get into that a little bit.
Yeah. It's been so awesome having Rikki in my atmosphere with this because she's someone who definitely values that. So what does that actually mean? So what is a clinical issue? Okay, so really there's a lot of tension, right? Also in this space. There are coaches and therapists, and I hear a lot of tension. There's memes traveling around, like, this one cares about this one cares about that. One of the things I actually hear traveling around is that therapists care about the past and coaches care about the future. So for me as a
Yeah.
CBT practitioner, that is comedy because my goal is to provide you with the space for healing that's going to get you where you want to go actually in the shortest amount of time. And I highly care about your future in every area. So something else, there's another area of overlap. Okay. So this area of overlap actually is where we could talk about our mild struggles. So a lot of clinical issues actually, they fall on a spectrum. Okay. So a lot of clinical issues, really what you'll find basically sadness could turn into depression, and you could look at stress could turn into a certain debilitating anxiety. So they really fall on the spectrum. In the mild area, there is an overlap. A coach will diagnose that and give it skills. I'm sorry, a therapist will diagnose that and give it skills. A talented coach like Rikki will just give skills and help, right? So that's what in that mild zone. Now, there are mental health issues that are certainly in a specialty arena. What I would say, they're very unique. They're obvious to us that they're a mental health issue. So those, even if they're mild, go to a therapist. Mild OCD, go to a therapist. Let's get that taken care of at a tiny age, even honestly. So it doesn't grow into anything. So that's where we have the overlap. And I'm on alive with a coach right now because there's so many areas that I see, let's say for adults, where a coach could be so effective. Someone could be so talented, let's say in relationships, right? You could actually have someone who's worked through their symptomatic trauma, but now they still can't like have a certain quality level of quality relationships. You can have a talented coach for that. Business coaching definitely takes people to the next level. Let's zoom in a little bit on teens because we all work with both. Teens are vulnerable. They're carrying a lot. They really actually nowadays I see actually need more support than less. Again, the nature of being a teen, they're carrying a lot. They need more supports. And adults in 2024 don't always have the presence that they need. So I'm excited to hear more about Rikki. You do both adults and teens. Yeah. So tell us more.
Yeah, so I think it's so true what you're talking about in terms of more mild, less clinical issues. And some of those things that I see with both adults and teens, it might be organizational skills, it might be expressing confidence, it might be help with developing solid friendships, right? And that could be for any age, from adulthood up to sorry, from teenager to adulthood, all of those things are really important in terms of just living a normal life. Not necessarily do you need, right? Not necessarily are you experiencing something super specific, like Malka was mentioning, right? Like something like OCD that really needs a therapist, or something super, intense, but something a little bit more mild. Those are the type of things you might want to seek out a coach.
Yeah, absolutely. And again, the goal in life, not all the issues we work through are clinical. There's so much growth that has to really happen in that arena too, that makes life exciting and wholesome. And especially with a teen, it's so wise. I'm going to kind of speak to parents now because I chat with your lovely teens a lot, and I chat with parents too. But I'm going to speak to parents is that if your teen is struggling with something and they're not going to talk to you, even your young adult, they're not going to talk to you, they're not going to open up to you. As lovely as you may be, radical acceptance. It's better that you handpick someone that you trust, that's values aligned, and you feel safe, and have them connect with this person, and that's pretty awesome.
Yeah, I think it's really interesting, like a lot of the teenagers I see, a lot of the issues is, confidence. They really need confidence and self-esteem. And like honestly, that's what we all really want for our teenagers is they're trying to form their identity. Who am I? And so, as a coach, I work through things like obviously self-esteem, confidence, knowing your worth, knowing what you want to do, your passions, kind of carving out, especially with the younger adults. Adolescence is kind of long. It doesn't really end when you're 19 anymore, at least. And so, career choices, what should people be doing with their lives? Things like that. The whole idea is we really want to, help teenagers and adults be able to be mindful of their physical and mental health, of their relationships, of their friendships, of their professional relationships. We basically want to be able, especially with teenagers, we want to be able to help set them up to handle life's pressures. That's really what we're doing. And so it's interesting because Malka was talking before about, clinical issues versus mild issues. And I actually wanted to ask her this question of, what exactly is the line between, worry and anxiety, or maybe sad versus depressed, or, challenge versus traumatized? We throw these words around a lot. And I wonder, like, when does it actually become clinical?
Yeah. So to answer that in like a sophisticated way, as we were kind of talking about that continuum earlier on, right? We have where the issues essentially are in that continuum, and at some point they become very, I would say, life interfering. So you would look at debilitating anxiety. I'm so scared it's stopping me from my daily functioning. Depression, my thoughts are so scary, it's stopping me from functioning. My trauma is highly symptomatic. I'm having lots of panic attacks. I can't sleep. That's when it kind of crosses that line into very clearly clinical. Something interesting that I'll do as a therapist, actually, with everyone I work with, is that not everyone gets to this point and needs that, but sometimes at a certain point I'll say to someone, you're not in active treatment. I mean, kind of in that language, like, you no longer need therapy. We like what you came in for, you're good. You don't need a therapist. And sometimes this happens a little bit more with teens. They'll pull a little bit at the supportive piece of it. And then at that point, even if I agree to continue to see them, I'll say that for you to know this is supportive therapy. And I think it's really important to draw that line.
Wow, I have to say that's like so authentic and amazing because, you could keep collecting fees from them, but just to like be honest and tell, especially teenagers that are vulnerable, like, hey, you might not need me anymore, but I'm happy to work with you. I think that's just like so authentic. Wow. Never, haven't really met so many people that are like that.
Yeah, so I think also, I think there's an edge because inherently there's a healing edge to therapy. So sometimes actually people can like the concept of going to a coach more because it sounds less problematic. And I think that's something we should honor sometimes, and we should actually tune into that. And especially if it's not in that red line therapy space, great, go to a talented coach. And I think oftentimes with coaches, I want to, even maybe young adults, I want to put this in. There's sometimes, I think what coaching is also filling a need for is this like mentorly presence, because a little off the record, but I don't know, maybe thousands of people are watching, so it's on the record. I wish our mentor programs were a little more, I can consult on that too, but we'll talk about that another day. But I think coaches are really filling the need, that this mentorly presence that people could be looking for as well. And I think that's an important need not to disregard. But I think also we want to acknowledge that the two can work together. So if Ricky's working with someone, an adult, and all of a sudden they're doing their thing, they had more than one panic attack. For instance, it's starting to repeat itself. They're kind of like freaked out by these panic attacks. We don't want it to turn into panic disorder, right? So at that point, Ricky can be like, just connect with Malka for a bit, connect with her, see what's going on, get some real clinical skills, and move on, right? So that collaboration is important. Something me and Ricky just want to super highlight is that we really value natural supports. So we don't want to be crutches. We want to empower. So if you need to go, and again, like we said, teens have big needs. People have be carrying very difficult stuff. So if you want to go to two people, that's not an issue. The issue is to ask yourself, is this empowering me? Or is this, or am I using this as a crutch? And also to lean into the fact, like I'll say to the people I work with, I'll say to the woman I work with at a certain point when we've worked through their trauma and they're vulnerable with me, I'm like, go be vulnerable with your husband. Open up to him because that's a point, that's an authentic point of connection in your natural environment. The therapy relationship is it's real. I always say it's a real relationship. It's still a therapeutic one, right? So that's an important thing that we want to really make sure your natural supports are activated fully.
Wow, that's like so amazing. And it's really true, right? With the natural supports, like when we say we don't want to be crutches, right? Like at least, with coaching, and I think with the type of therapy that Malka offers, they're goal oriented. And so it doesn't necessarily last forever. It's not that we're kicking someone out. It's more that we want to empower them that they could be independent if they so desire, right? So I think that's awesome. And it's such a good point.
Yeah, and something both Rick and I do is that in therapy we'll call it booster sessions. Coaching has so much creativity with how things are packaged, but will if you already have a relationship with a therapist and there's someone or coach and you connect with them, sometimes in key moments in life to just get that objective perspective from someone, booster sessions, I love that. I'm maybe it's a little selfish because I care about my clients. I think about them randomly. I hope they're doing well. I tell them to randomly send me emails. And I'm so happy they don't need therapy. But if they need it at a certain point, right, those booster sessions of being able to just connect with someone you already have a relationship with in a key moment, that's another way to use coaching, to use therapy, to use these supports, not as a crutch, but as a way to be empowered.
For Sure. Yeah, I think it's so true. And what's really interesting about Malka specifically is, right, I was telling you when I was introducing her at the beginning, during technical difficulties, she offers something really cool, which is a short-term therapy for, it's also known as brief therapy for like high-powered women who don't necessarily have a lot of time but do have, therapeutic goals that they really want to get into. And what I think is important is that, yeah, that might sound similar to coaching, and sometimes, and I think Malcolm will agree with this, it's not right if it's not a clinical issue, if it's not a specific issue that needs a therapist, sometimes it's actually just about the particular person. It's about the coach or the therapist that you're actually talking about. Like it's not about the title, but it's about the person, right? Like there's some really powerful coaches, some really powerful therapists, also not some not so powerful coaches and not so powerful therapists, but not in OKclarity, only in other places. But the goal is you also want to find a practitioner that's looking to generate change, that's generated change in the area you're looking to generate change in, right? Someone that's, I don't know, humble, qualified, their skill set, is something that you really relate to, and you feel like they have the ability to help you. They've developed themselves enough. And I think that's a really big deal is that you want to also think about the person. Are they an expert in what I'm looking for? Are they going to be able to help me? Because sometimes you just need the perfect person and they're a therapist. I wanted a coach. They're a coach. I wanted a therapist. And it really doesn't matter.
Yeah. I love what you're saying, Ricky, in terms of this balancing. You want someone who balances humility, right? That they're always in their own professional way, they're always developing and they're growing. And you want also someone who has that confidence of I've generated change for X amount of people. I've generated, that you're able to say that. Like when you call them with your concern, it shouldn't like knock them off, It's a
Yeah.
normal question to ask. It's a normal question to ask. So roughly, like, how long do you think this will take? And sometimes in the therapy field there are debates about this, but I really think it's normal to ask, and again, a professional will tell you, like, everyone's unique, but generally, if this isn't very life interfering, we really should see hope. We really should see change in X amount of months and X amount of weeks. That's what we should be able to see. So I love the things you highlighted, Rikki, there. And I think something I want to leave you off with that's kind of relevant. We're really leaving time for questions, guys. So really,
Yeah, ask questions.
we really were focused on time. I was happy to chat with you guys for longer, but we're focused on time. So, but because we have to be, so yeah, but. Something really lovely for this wonderful OKclarity platform is that also something you're looking for, and is kind of someone that, is sometimes you're looking for values to be aligned. That's something important too that you're looking for in an individual. So, and especially, I think I want to highlight that that's very, very true for the coaching process, right? So you could have a team that kind of comes to Rikki and maybe did some trauma work in the past with the therapist, and now comes to Rikki and is like, and is a whole world of value exploration, right? Like, how do I come from this past of trauma? How can I, like, how can I explore my values? What would it take to build X kind of a home or X kind of a sense of self, right? And all these, and that value exploration, it's so rich, I think, actually in coaching. In therapy, it has to be much more, we're much more careful with it, because really the art of therapy is being able to clear the inner noise of the trauma, of the anxiety, of the depression. So in DBT, we'll talk about wise mind, right? The goal is to access that inner kind of value reservoir, right? And therapists, ACT therapists, right? DBT therapists, we are busy with values, but it's more about clearing things up so you could tune into them. You can make decisions from that place. But I think with a coach, and also values for me have to come from the client. I'm not that has to come from the client in the therapy process. That's really important. And not all, that's a thing us as therapists, we have to be very responsible about. And at the world at large, I know we're in an OKclarity platform, but the world at large, I don't think we're holding as a therapy system yet where we're crafty enough with that. But I think that point proven, I could get deep and philosophical about this, but point proven, Rikki, I think I made my message clear that with coaching, I think there's more richness with this. And with therapy, it's about the values that come from the person. So that value alignment in coaching, I think, is really cool.
Yeah, that's so interesting. Wow. I never like thought about it in that way, and I think it's such an interesting idea, like the whole idea that therapy is really clearing the mind so that you can actually, and clearing any, mental unwellness, so to speak, so that you can get to this place of exploring values, which is again why we were talking about also how awesome it can be, working together. But anyways, we would love to take questions if anyone has any in the comments. I saw one come in earlier, something about ADHD. Someone asked, what kind of therapy do you recommend for ADHD? You want to take that one, Malka?
Yeah, I would take both an ACT approach and again a CBT approach as well towards that. It's really essentially about learning, with ADHD work, it's really about getting a lot of good behavioral management skills, but also getting a lot of really good mindfulness skills and acceptance around the facts, around the emotions and the thoughts that come up when you don't want to do tasks, and really being non-judgmental with that. So usually CBT, DBT, ACT will blend that. And will, with younger kids, it's more behavioral, really giving them strategies to understand their unique needs, and to really channel the powers of ADHD. I think the entrepreneurs, I love the high achieving woman, right? There's often, there's a lot of strengths in in those kind of struggles.
For sure. Yeah, I think you said it like super, super well. And then there's another question here. It's not necessarily what if you want to learn more about yourself, but also want to work in anxiety and relationships? I think it's a great question. Um, so I feel like we touched upon this, right? And we sort of, and Malka can, piggyback on this. We sort of talked about like it depends. Like is the anxiety clinical? Like how severe is the anxiety, right? You wanna comment more on that? Right? She said, do
Yeah.
you see the question?
Yeah. So I am kind of hearing parts of it. So learning more about yourself, definitely coaching and therapy could actually both be spaces for that. Again, you would have to set those goals with both people that you reach out to. But I don't see those as a contradiction, but you said, but I also want to work on relationships and anxiety. So I think that it's all about mindset, and it's about maybe working on everything at once. Could be too overwhelming. Like, I'm going to work on my relationships, my anxiety. I'm going to learn about myself. So that's also something really important, is to be able to prioritize your wellness journey. And that's the compassionate part of, like, we don't have to, we don't have to get like all of our weaknesses. Like, we don't have to, work through them by by tomorrow, so being able to accept parts of yourself that working on that is going to knock off the balance in your life, that's not a wellness journey, right? A wellness journey is being able to prioritize. So if I was, working with this question more specifically, it's like, what do you mean by anxiety? How's it getting in the way? And I would always start with the things that are getting in the way of your life the most. And then we can move into things like, where are you most motivated? What do you want to change next? And always checking in that we're on the journey in a healthy way, because wellness shouldn't become an addiction either. you know?
For
Which
sure.
kind, which kind of I see in the high-powered world of really ambitious people. Um, there is this there is this intensity around wellness that I actually think is the opposite of wellness. So I think we've lost this. We're losing the simplicity in this art, which a plug for Faye doesn't need a plug. She's incredible. But I'm saying she's doing like this thing with walking for wellness, like the simplicity and the beauty of that, right? Is just so, it's special. Okay.
For
Yeah.
sure. Yeah. I wasn't sure if the person was asking, like, if she wants to work on two different things, or if she was asking if she wants to work on something that would be more like coaching oriented or more therapy oriented. But either way, I think you answered it. I think
Yeah, you
both
can
could.
ask another question. If no one's asking questions, we have a little bit of time. Feel free to clarify your question. The more specific, the more we.
Yeah. And I think there was maybe one other question that I may have missed. But I'm just looking for it. I can't find it, so maybe I missed it. But okay, so far there is none. But we really enjoyed this live. It was so great. Malka and I were really like thinking about this idea of coaching versus therapy, and we're like, how cool would it be if we actually discussed it as a coach and a therapist? Because, there's definitely a lot of like, stay in your lane, whatever. But, we're, friends, and we really value each other as professionals. And we wanted to be able to share all that with you. And, I think hopefully what you got out of this is that, we really believe that it's all about mutual respect and collaboration. And as long as there's that, like anything can actually happen. Oh, I see the question, and we'll just end with this. I want to work on these areas, but like you said, either field can be helpful. Yeah, I think either fields can be helpful. It, depends on the action. And I think maybe this is where it comes down to the person. Is there a specific person that you think would really be impactful for you and is an expert in that area?
Right, right. And if you're asking, right, either can be helpful. So you want to ask them if they could be helpful, but you mentioned anxiety in there. So I would just check in. Is it like generally having anxious thoughts about general anxious thoughts? Like, what happens if I do this? What happens if then both can kind of be helpful. If it's some very specific anxieties, if it's like very high levels that are debilitating, that's
Yes.
when it's therapy
For
lane.
oh, for sure, for sure.
Yeah.
I think that goes without saying, but I'm glad you said it. For sure.
Goes
Okay,
without saying
amazing.
after our live, Rikki, that we made it clear.
Yes, but
We
yeah,
hopefully brought
but general,
clarity.
yeah,
Exactly.
amazing. It
Both
was
both could be helpful. Yeah.
amazing. Okay, so great. We'll see you, and thank you so much. We hope you've gained clarity, and check out OKclarity for more.
Thanks, everyone.